Okay.
Mr. Miyagi.
The piriformis muscle. This is probably one of the most neglected and misunderstood muscles in the entire body. Now it's located right down here. You have all your lateral rotators, okay? The biggest one here in the middle is your piriformis, all right? Now the functioning of the piriformis goes like this. Goes out to the side and to the back. There you go. What a lot of people don't realize is that when they're doing squats or training legs, especially women that want to build their glutes and train them like 3 times a week, okay, you can't squeeze your glutes all the time because you're essentially squeezing the muscles underneath the glutes constantly. And when you do that, you end up locking the muscles in a short position. Going to the side. Okay, now if you notice when she did that, go down again low. Okay, notice there was a little bit of a dip in her hips right there. Okay, that, come up again slowly. All right, come back down again slowly. Right about there. How her hips kind of dip down like that. Okay, all right, you can stand up. Here I'm going to show you how to actually open up these muscles through a very basic and simple to do massage technique, okay? You have to understand the anatomy a bit to really know what you're getting into. So here we're looking at the lateral rotator muscles right around here, okay? In order to open up this muscle, okay, you want to go ahead and find the spot where it's a little knotty. You're going to go ahead and pick the leg up like so. Okay, you're going to do what I call the windshield wiper method, okay? You're going to gently press in here until you feel a bit of resistance, and then you're going to go ahead and rotate the leg while pushing it at about a 45-degree angle, okay, out like this, until there's resistance and you can't push anymore. You want to come back this way and do the same thing, okay? If you notice there's a little bit of twitching going on, that's because the compression mixed with the inflammation is cutting off the nerve signaling a little bit. However, we need to do that so that we can get the blood supply in there and allow it to open up. Okay, when it's already tight, this is very normal. Okay, and I promise you, when you do legs after this, you'll be able to squat a truck. Okay, nice and easy. Okay, back and forth as far as the range of motion will allow. Okay, don't get too rambunctious and attempt to go all the way. You're going to end up bruising your partner, and then I'm going to be kind of pissed at you. Okay. Now, the best idea is to go all the way around the muscles, all the rotators, not just the piriformis. Okay. Back and forth, and come up. Back and forth, and ensure that they're staying relaxed. If they tense up, then it completely negates the ability for this muscle to open up. So they have to be relaxed. Okay, nice and easy and nice and slow. Allow the muscle to stretch out and open up. There you go. You can use your elbow, your fist, your fingers, really whatever you're most comfortable with. Okay, you want to take a good, I'd say 5 minutes each to do this. Okay, and you can do this really anytime. However, it's very beneficial to do right before doing legs, actually. Okay, especially if you've been getting lower back pain when you work legs. Okay, so you want to be sitting on the same side. Okay, I'm sitting over here and doing that one so I can demonstrate properly. Demonstrate so you guys can see it the best. Okay, I'm going to come in because being able to press away from you is gives you a little bit of a better stability. Okay, and if you get to a point where you're pressing about the same and the leg just kind of locks up, all right, just let it sit there, and if it starts shaking like this, sit here and allow it to shake a little bit. That's okay. Because when you let go, that's still going to open up the muscle. Sometimes they're very, very tender, and when you get in there, they can kind of go nuts a little bit. All right, that's the central nervous system getting the nerve impulses through these compressed areas of muscle tissue. And I can promise you that about 9 times out of 10, the person's going to have a tight piriformis. This is everybody that I've worked with and worked on has a tight piriformis. Even people that do yoga religiously. This seems to be the one muscle that nobody can escape getting tight because of its emotional response or its physiological response to emotional stimuli, or stress, I should say, as well as physical response to physical stimuli. All right, so this side's a little bit tighter than the other one. I'll sit here and do this for a few more minutes, and then definitely check out her form and make sure she's good to go. All right.